The most common symptoms of arthritis in the hand is pain and also swelling when it affects a specific part of your knuckle here or here, and more commonly in the thumb base. It's really painful, and patients struggle to do their day-to-day activities, which would involve gripping things or moving it in your day-to-day activities. So pain, stiffness, swelling, these are usually the symptoms that we have when patients come to see us with arthritis. The commonest area that we would find is the base of the thumb, usually in middle-aged women, where a lot of action and motion has happened throughout their early years. This joint here, which is not a very congruent joint, undergoes arthritic changes, and they come in complaining of pain there. And after that, commonly seen joints are what's so-called the metacarpophalangeal joints, which are these knuckles. And you also see some bumps in this part where patients also have pain. And again, we also see arthritis affecting these knuckles. And sometimes you can rarely have an unfortunate scenario where almost all the joints are affected and becomes a very difficult problem to treat. The things to look out for are arthritic pain is worst after you've done some activities on it, and it tends to be better in the day or in the morning first thing. And after you've been asleep and you're trying to get going, patients might usually say that my hand feels stiff or that particular joint feels stiff to get going. And any activity associated can cause swelling and warmth of that area. So these are generally the signs and symptoms to say that there is arthritis. If there is progression of the symptoms, then we can have clunking and some bone-on-bone grating sensation coming in as well. Treatment of arthritis in the hand is very similar to any other joint. We start by lifestyle modifications, seeing if the patient can stop the heavy activities that they might be doing to try and offload that joint, and give them some splints to protect the joint. And physiotherapy also helps in the initial stages. Then we move them on to small interventions such as injection with some cortisone within the joint under X-ray guidance or ultrasound guidance, depending on the joint. And if that, again, hasn't worked really well, then you treat them with operations. And operations briefly are joint replacements, such as elastic or metal joint replacements, or joint fusions, where we stiffen the joint up. Because it's so arthritic, there is very little movement in it. And if you stiffen it, there won't be any movement, and as such, there'll be no pain. So arthritis, how it begins is a very complex thing to solve, and people are still trying to find out why that is the case. It's a multifactorial problem. Sometimes genetics are known to play a role, such as it's a hereditary condition. Sometimes environmental factors, such as the kind of work that you would do. But you can't really say because you do this work, you definitely have had arthritis from that. But it's often a multimodal thing. And also, depending on what kind of activities you've been doing throughout your life, that also precipitates that. And there is some research to say that patients going through menopause, they tend to lose their estrogenic effect. And as a result, their arthritis flares up much common.